Hello, and welcome to this month's Support Coordinator webinar. I'm Vicky Gray, your host for today's session, proudly brought to you by Endeavour Foundation. This month, we're excited to delve into evidencing complexity and significant support needs with our guest presenter, Mary Ingerton from Support Coordination Academy. As we gather online, with attendees joining us from across Australia, I'd like to acknowledge the significance of the lands we all call home. If you'd like to honour the traditional custodians of the lands you're logging in from, feel free to share the name in the chat. I'd like to begin by acknowledging the Gubbi Gubbi people, traditional custodians of the land on which I'm hosting from today. In the spirit of reconciliation, Endeavour Foundation acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Now, before we get started, a quick note on housekeeping. Your microphones and cameras will stay off, but we'd love for you to join the discussion in the chat. If you have any questions for Mary, pop them in the Q&A section and we'll answer them after the presentation. You'll also find a link to our privacy policy in the chat. Feel free to reach out if you have any questions about that. Now, before I introduce our speakers, I want to highlight our past webinar recordings. They're full of valuable insights, strategies and practical tips. You can watch and catch up anytime on our YouTube channel. So just follow the link in the chat to start watching. Now, we've received several requests from attendees over the last couple of months, asking to make these live sessions more accessible. Thank you so much for your feedback. And to help, we've added instructions on your screen for enabling live captions in Microsoft Teams. Let me walk you through that now. If you click the More button on your toolbar, then select Language and Speech, and then Live Captions, you'll now see captions in real time at the bottom of your screen. We'll pop the instructions into the chat too, in case you missed that. As mentioned earlier, during this webinar, we'll dive into the topic of evidencing complexity and significant support needs. Our presenter today is Mary Ingerton from Support Coordination Academy. Coming up shortly, Mary will walk you through how to tell the difference between complex and high complexity situations, tips to confidently document and evidence high complexity, and what to include in your NDIS reporting to show the need for different or additional supports. Now, before handing you over to Mary, it's my pleasure to introduce you to Shania Brennan. Shania is Endeavour Foundation's Business Improvement Specialist, leading a team of social workers and disability specialists who advocate for our clients. With qualifications in psychology, HR management and social work, plus 8 years in the community sector, she's passionate about empowering vulnerable people with choice and control. Over to you, Shania.
Hi, everyone. Sorry, it took a second for my camera to come on. Alrighty, so hello, thank you, Vicky. And as always, it is really wonderful to be here with you all today. So as Vicky mentioned, I work with Endeavour Foundation and I lead 2 teams that advocate for people with disabilities in the change of situation space and in the intake and inquiry space. So as you know, today we will be discussing how we evidence complexity and significant support needs for participants. And I'm here to talk really briefly about how Endeavour Foundation might do this. So you can see here on the slide, I'm just going to talk through each of the points you see. When we look more broadly at what approach we take to evidencing support needs, some of the key things that we really focus on are making sure that we have clear and factual supporting documentation that evidences a participant support needs. And that looks like focusing on the support needs specifically, using factual language and speaking about the events or situations or needs and not speaking about feelings or personal interpretation of events. Consistency is key, so supporting documentation that clearly demonstrates that the participant consistently needs a certain type of support. So we really focus on making sure there is a clear timeline of the supports required. It's not just a day or a week here or there. It's about evidencing a really clear need for the support on an ongoing basis for the participant. And lastly, one of them, the most important, is that the participant is at the centre, and that's always the case. So making sure that supporting documentation highlights the participant's voice and how the support will assist them in achieving their desires, their goals, their needs, their wants. It's their life, and we're there to support them in their independence. So as I'm sure everyone here can agree, the more supporting evidence that clearly talks to and solidifies the participant support needs, the better for a funding review. On the slide, you can see some of the types of supporting evidence you could ask for from a service provider. All of these can assist with demonstrating a really clear support needs to the NDIS. Something that Endeavour Foundation do specifically is that we have our advocacy team, which I look after, that assists support coordinators and our internal teams to develop change of situations. This team not only pull together all of the supporting evidence, they're a team of social workers who also they will write support needs assessments, which holistically demonstrate a participant's support needs. And this is something that we do in collaboration with support coordinators for the people that we support. One of the other really key pieces of supporting evidence I wanted to touch on before Mary jumps in is on high intensity supports. So I've seen lots of outcome letters with feedback that the NDIS are looking for logs or really clear logs, for lack of a better word, that isolate the type of support needed for high intensity support specifically. So an example would be that a participant needs an active awake support worker overnight because they require, say, regular repositioning and continence support to reduce the risk of developing pressure sores. And we have a number of participants that we support that require this level of support. So what we often see is that the NDIS ask us for sleep logs and being able to really clearly show the time the support's required, how long it's required for, and what the support worker is doing during that time. And we've seen some really great outcomes when that level of evidence is provided with securing that type of support for the people that we support. That is just a really quick snapshot on how we navigate evidencing support needs for the people that we support across Endeavour Foundation. So now I'm going to hand over to Mary, who will take us through the rest of today's presentation. Thank you, Mary.
Hi everyone, and thanks very much. I really appreciate it. I really love the idea of the intensive or really high complex needs logs because they make such a difference in relation to evidencing support needs, especially when they align or there's recommendations around increases in support. So that's just awesome. Okay, so hopefully everyone can see the PowerPoint slides. There was someone who just said that they couldn't see them. Maybe log in and log out again. So today we're going to be talking about evidencing complexity and significant support needs. This is the question that I get all the time. And it's really in relation to, I talk with a lot of support coordinators who had said to me that supports have been reduced. And then when I've kind of reviewed their reports and things, I often see that there is evidence there, but there's no really good reporting to bring that all together and summarize and highlight the key points in relation to the impairment, the impact of the impairment, the reduced functional capacity, and the barriers and risks that are evident, and then therefore evidencing the additional different supports that are required. And I think the other thing that I really find too is support coordinators tend to forget about really articulating the support that they're actually putting in place. So how are you managing that crisis, or how are you managing that situation? Just a bit of a heads up before we go into the presentation. The other thing is, just before we go in, just to mention that we actually have specific training around this, around how to evidence really good complexity and how to write really good reports. So if you're interested, go and have a look at our website. and under our professional skills training, which is happening in May. Okay, let's start getting into it. Okay, so let's first have a look at support coordinator responsibilities. So support coordinators are responsible for accurately documenting and gathering evidence of high complexity in a participant situation. And this ensures that the NDIS reporting is clear, comprehensive, and effective. So some of these skills really enable a support coordinator to advocate effectively for their participants. So in the context of support coordination, advocating means ensuring the NDIS has the right information and strong evidence to clearly evidence and demonstrate a participant's support needs based on the complexity or the level of complexity in their individual situation. So because support coordinators are intermediaries between a participant and the NDIS, so understanding how to assess and document complexity ensures participants receive the right level of support and funding, whereas poorly evidenced and written reports can mean participants miss out on crucial supports. So meeting NDIS expectations. So the NDIS expects support coordinators to provide objective, detailed, and outcomes-focused reporting. Outcomes-focused reporting is really, really important. Knowledge of NDIS language, documentation practices, and being able to clearly articulate different levels of complexity and the impact on participants will enable a support coordinator to meet these requirements and avoid delays, plan cuts, or unnecessary plan reviews. So navigating systemic barriers, and this is something that we do every day. So many participants with complex needs must navigate multiple service systems, so including housing, education, mental health, justice, health, child protection. So if support coordinators are unable to clearly articulate and provide evidence of the barriers these systems present and how they affect a participant's ability to access appropriate supports, there's often a risk that the participant will fall through the cracks, meaning that they're not getting access to the support that they need. So it also strengthens professional credibility. So good documentation and evidence-based reporting not only benefits participants, but also demonstrates a support coordinator's professionalism, building trust with participants, NDIS planners, local area coordinators, and the rest of the support network, so the family that you have connection with, and anyone else who is in that participant support network. It also protects the support coordinator themselves as well as their organisation. So clear factual documentation creates an audit trail that protects support coordinators and their organisations in cases of disputes or complaints and investigations by the Quality and Safeguard Commission. It shows that decisions and actions were based on evidence and not assumptions. And lastly, it promotes sustainable practice. So supporting participants with high complexity can be emotionally challenging, and we all know that. Consistent documentation and structured reporting help prevent burnout by making participant program and systemic barriers easier to identify, track, and address. So let's have a look at assessing complexity. So what are the differences between a complex participant situation and a highly complex situation? Again, this is a question that I get quite often. So let's have a look at complex support needs. So at support coordinators, at the moment, we only work with people who have access to the scheme, to the NDIS, who have been assessed as having complex support needs or barriers to participating in those processes and being able to access supports and services that they need. Yeah. So, and that's at the moment is assessed by the NDIA. So let's have a look at complex support needs. Participants with complex needs require support across multiple life areas or domains. So these are things like housing, health, employment. But their situation generally involves coordination between 2 or 3 service systems. So these participants may experience challenges in accessing appropriate services, but with well-organised support, they can often engage with systems and build capacity to increase their independence. So I'll give you an example. So if a participant has an intellectual disability with a secondary diagnosis, say, of epilepsy, The participant may rely on aging parents for informal support. However, this support is no longer viable or sustainable. So the participant may live at home and is keen to explore home and living options. They may require assistance to navigate NDIS processes, manage routines, medication and appointments, and are keen to access supported employment. So you can see there's a number of domains and areas that create complexity for that participant. So highly complex support needs. Let's have a look at that. So highly complex support needs is when participants have support needs that face more persistent and intensive challenges across multiple areas and domains. So these participants may experience significant systemic barriers, including histories of trauma, service disengagement, risk of harm to themselves or others, including involuntary systems like child protection or justice. Could also be adult guardian. So the intensity and persistence of these issues often make accessing support extremely difficult without additional and targeted supports and a well-coordinated support network that works collaboratively to ensure everyone is working towards the same goal, which is the crucial role of the support coordinator, bringing all of those support networks and systems together, ensuring that that support network is coordinated and collaborates together so that everyone's working towards the same goals to support that person. Okay, so the difference between complex and highly complex could be a participant with a schizoaffective disorder and an acquired brain injury and maybe a substance use. So the participant might have multiple hospital admissions per year due to mental health challenges. The participant could be a substance user and distrust service systems due to past trauma. Their acquired brain injury may affect their memory, executive function, and impulse control, is often excluded from mainstream services due to aggressive behaviour during high episode. So you can really see the differences between complex and highly complex support needs. Okay, I'll keep moving on. So documenting high complexity and support needs. So why do we need to do that? So it is critical that a support coordinator has the skills to document clear evidence around a participant's support needs, which enables the NDIA to understand why standard supports may be inadequate. This includes supports that need increased funding or additional hours of support coordination to manage a crisis situation that requires an intensive level of support. So when we do this, it demonstrates functional impact. So demonstrates how complex barriers, say mental health, homelessness, justice involvement, directly affects the participant's functional capacity, engagement, and ability to use support services effectively. It informs planning and reviews, so builds a clear picture of the participant's lived experience to inform NDIS plan decisions, especially for reviews or change of situations. It supports advocacy and interagency collaboration. So it helps support coordinators advocate for access to mainstream services, things like crisis housing or even mental health care. It provides a shared understanding across the support network of the participants' unique support needs and the goals. It also ensures continuity of services and supports. And I find this is a big one, especially when support coordinators go on leave or they hand over to another service or new service providers come in, especially allied health providers. So when there's multiple providers or staff are involved, even support worker teams, detailed documentation ensures that future support coordinators or even allied health professionals or support workers understand the complexity and the history of a participant's support needs. So what's been tried, what works, what doesn't work. Okay. I'll keep going. How are we going? We're going really well for time, which is good. Okay. What about strategies for effective reporting? So One of the biggest things that I find really works really well is documenting a timeline of events. So what are their challenges and changes in the order that they occurred? So highlighting patterns of systemic failure. So this helps to really identify that things happen over a period of time and that they're not isolated. So repeated disengagement or escalating risk. So what happened in the event? What happened next, and then what happened, and then what happened? So what supports were put in place? So what were the safeguards that were wrapped around that person? How did the support network work together? And then what happened? So the situation might have continued to escalate. Why did it continue to escalate? And then what happened? So really doing that in a sequence helps to really explain to the reader the sequence of the event and the continued impact on the person. So the timeline helps the NDIA understand that challenges are not isolated incidents, but part of an ongoing complex situation that justifies sustained and intensive support. Okay, hopefully I'm making sense. Okay, identifying the specific barriers the participant faces and how these barriers impact on and create risk for a participant. So throughout our training, we often talk about personal and situational factors. So these are the factors that we see in everyday situations with the participants that we support. So it was leading back before when we talk about the difference between complex and highly complex. So it's more in relation to the participant themselves, the influence or those factors that impact on them and create barriers or risk, but also the environment that they live in, the people that they associate with, or the complex level of providers that are networked around them, or they might have complex medical needs. So it's really thinking about what are those factors, how do they create barriers, and they impact on create risk for a participant. And this is when, by documenting and really being clear about the sequence of events, it really helps to show the reader how the situation started off as complex and how it actually became really high and complex, and then risk became evident. Okay, so helping identifying barriers helps demonstrate why standard supports are not sufficient and why specialised, flexible approaches are necessary. Yeah. So basically what I'm saying there is quite often when we have standardized supports that have been provided for a participant based on the impact of their impairment, as a support coordinator, we gather evidence to go, well, that might work for that person, but it doesn't work for this person, and this is why. Okay, so identifying who is in the participant support network and detailing how you've tried to coordinate between them, as well as where collaboration has failed or been refused. So if you're trying to link into a mainstream service or link into some other service, or you're trying to engage a funded provider, but there's a massive waiting list. So really documenting the actions that you have taken, but also when collaboration has failed or been refused. And it might be that you've contacted a mainstream service and they, as part of that interface between the NDIS and their service, say mental health service, they have an obligation to actually support that person, but they're coming back and saying to you, we don't have the resources. Okay, can you please document that in writing? Because that becomes part of my report. Okay. Capturing the participant's own words, behaviours, or non-verbal cues that reflect their experience, frustration, or desire for change. Incorporating the participant's voice reinforces that real-world impact of system failures and grounds your report in lived experiences. Really, really important. And it might be if a person doesn't have the capacity to do that, who are the people around them that observe the change, that can really understand the impact for that person? Also, gathering evidence from the support network to substantiate the impact of high complexity in a participant's situation and the need for additional or different supports to effectively manage the situation. So evidence strengthens the credibility of your report and makes it easier for the NDIA to verify the need for additional or specialised supports. Okay, probably telling you things that you already know, but it's really understanding what the NDIS needs to see. Okay, let's have a look at NDIS reporting expectations. So when completing NDIS reporting, it is critical that a support coordinator knows how to write effective evidence-based reports. Keep coming back to evidence-based. So using clear, specific, and factual language. So avoiding emotive and subjective language. So say, for example, instead of saying a participant is very challenging, rewording it to say a participant demonstrates behaviours of concerns resulting in service withdrawal on 3 occasions in the past 12 months. So keeping it very clear, specific, and factual. Okay. Be clear about how the participant's impairment impacts on and creates barriers to accessing supports to complete daily activities. So how does it impact on that person? How does that create barriers for that person to be able to getting those supports that it needs? And then when the complexity increases, now how does that impact on that person? So now what are the barriers, and does that now create risk? And also identifying the supports that have been put in place and how they have been built or maintained the person's capacity for increased independence or reduced risk. So being built or maintained is really, really important to understand. So the NDIS constantly talks about how have you built capacity. So capacity isn't just about something continually improving. Capacity is also about a person's ability to be able to maintain that stability. So you might be working with someone who previously their supports were up and down, and there was constant instability, constant disengagement. The person constantly became overwhelmed, regressed. So how has that changed? If you've actually built capacity so they can actually stabilize some of their supports, then that's actually building capacity as well. So you need to think about what's changed, what's different, okay? And also linking that back to the person's goals. How does that capacity being built or being maintained actually link back to a person's goals? So clearly linking requested supports to a participant's goals and how the support will assist the participant to overcome barriers and pursue their goals. So how will those supports actually help that person to overcome those barriers? So what are those strategies? Are they in relation to funded supports, mainstream supports? Is it in relation to community supports, or is it leveraging off those informal connections? So this aligns with the NDIS principle of providing individualised funding to assist a participant to pursue their life goals and live a good life, and is a requirement under the reasonable and necessary decision-making criteria. It's one of the things that I find quite often that people forget to do. You need to link all of these recommendations back to a participant's goal. How are your recommendations support or additional supports or change in supports? How is support coordination going to support someone to pursue and achieve their goals? You always need to be recommending these or adding this back into your reporting. And then consistency in evidence. So evidence provided should be consistent across the participant support network or stakeholder group, depending on the language that you use. So as an example, say an occupational therapist recommends psychology support due to difficulties with maybe emotional regulation. This should align with a psychologist report that supports the same recommendation and outlines how the participant's capacity can be developed. So I know sometimes that is quite difficult, especially if supports and services aren't available, but it's also about thinking about creative ways that you can gather evidence from different sources to basically back up each other and provide credibility around the evidence and the recommendations that are being made, and being really, really clear about what is the impact of the person's impairment, how does that create barriers and or risk, and how will these supports enable this person to overcome these barriers to support them to pursue and achieve their goals. So ensuring, again, that there's a clear connection between the participants' complex barriers and the supports being recommended to address and overcome these challenges. Okay, hopefully I didn't talk too fast because I know that I do tend to do that. We're going to actually move to questions. I thought there would be lots and lots of questions around this, so I have provided quite a bit of time. I'm going to have a look at the Q&A section. Okay, Okay, now it's just loading. Okay. So I'm going to go to I've been told to go to the bottom. Okay. At what level must the support coordinator cease advocacy for a participant? According to the legislation on the NDIS website, your support coordinator should not act as an independent disability advocate for you. However, your support coordinator can help you to understand when you might need a formal advocate. Okay. Really good question. The NDIA constantly talks about support coordinators are not advocates. What they are talking about, and that's the difference that I was talking about right at the beginning. So what they're talking about is formal advocacy. So formal advocacy are funded advocates that are funded by the government. And you hear about it all the time. The NDIS review recommended more funding for formal advocacy because quite often it's hard to get link people in with formal advocates. So formal advocates, you can Google them on your website and link participants into them. So if you've got a participant who's going to a tribunal, or you've got a participant who you feel might be going for review, or there is something happening within their lives that they need that hands-on support to walk alongside them to advocate for their rights, that is a formal advocate. Okay, there's a difference. So what I am talking about when I talk about, and I'm just going to go back and find it. Okay, so what I'm talking about when I talk about advocacy, I'm talking about, as support coordinators, we advocate for participants all the time, but we do it in a way that it's not formal advocacy. It's more in relation to ensuring that we provide the right information and strong evidence to clearly demonstrate a participant's needs, therefore advocating for the support that they need. Yeah, so we do that as part of our role all the time. There is a clear difference. Hopefully that's making sense. Okay, how do you evidence building capacity for a diagnosis of early onset dementia when even though support's trying to maintain capacity, this capacity decreases? Okay, sorry, and increased risk constantly incurring. Really, really good point. When you are working with someone with a impairment or disability or impairment that will deteriorate over time, it's really thinking about what are those person's goals and what does their good life look like? What is it that the support that they need to live the best life that they can within that period of time? So that's how you evidence building capacity. So again, it's not just about increasing skills, increasing development, increasing more independence. It might also be about maintaining that person's quality of life. So you would then be looking at, so what are those person's goals? How can we support them to maintain that level or quality of life? And what are the supports that we're putting in place? And then you're evidencing how you've done that. So these are the barriers for the person. This is the impact of their impairment. It will decrease over time. And so there would be regular monitoring. You're linking in really good health services. You are ensuring and having regular networking meetings with the support network to ensure that there is constant monitoring of that person's disability-related support needs. So that's how you are building capacity. It's around focusing on that person's goals, but it's also about quality of life, maintaining their level of quality of life. Hopefully that helps, Megan. Okay. Sorry. Other examples we can access to show what is a stellar and or bad report. Looking the wording later. Yes. Jenny, we actually provide that as part of our training. If you go and have a look at our professional skills training on the support coordinator website, we actually provide you with templates of NDIS reports, a support coordinator report filled in, giving you examples of what a good report looks like, the language that you use, the layout, all that kind of stuff. Okay. New post. I'm just trying to, Kate, right. Okay. Okay, if a participant has moved from one support coordinator to another, how, and you get access to the previous information, the participant has an intellectual disability and is complex and highly complex in some areas. Really good question, Amanda. I find this a really challenging one within the environment and the way that the role has been set up. For me, there needs to be really clear practice standards around professionalism in relation to support coordination. And that's in relation to, we provide a very good safeguarding role for participants, and there needs to be consistency in service provision. It's what I was talking about as part of my webinar. For me, as support coordinators, we need to act professionally, and it's part of our code of ethics as well. So to act professionally, if someone is leaving your service as a support coordinator and they're moving to another support coordinator, my belief is we have a professional responsibility to do an effective handover for that participant with their consent to ensure that that person understands that person's context and they're not having to start from the beginning. I've always done that when I've handed over participants to another support coordinator, especially when I've done level 3, handing over to a level 2 to implement the plan that we've put in place. And it's something that you need to be negotiating with the previous support coordinator. And that might be through the transition period when the person's still, going through their cancellation period or whatever that might look like. For me, it's a professional requirement. When people don't do it well, it doesn't look good as professionally. And I don't actually understand why that happens, because it's not actually about us as support coordinators. It's about the people that we support, ensuring that they get that consistency of support and services. Okay, Lolita asks, how do you diplomatically support the parent or plan nominee of an adult participant to understand evidential requirements versus emotive reasons? Really good question. I think it comes back to your communication skills. Especially when you're working with parents with a person with an intellectual disability who they've looked after all their lives, as well as when you work with parents of children, it can become very emotive. There's often grief involved, especially if the person wants to move out of home or the person hasn't, gone through those developmental increases within their life. So it can be very, very emotive. And it's really having those really hard conversations around, I can understand, and empathizing with that person. I can really understand where you're coming from. And then having those realistic conversations says the environment of the NDIS, and this is the reason we start criteria, and this is how it works. So let's look at the supports that we're talking about and see whether they're able to be engaged or sourced through the NDIS. Let's have that discussion, talk about, are they related to goals? Are they related to social and community development? Are they value for money? What is the expectation of informal supports? Do you have that capacity? So really getting them to understand and educating people about the NDIS environment, how that works, but also looking outside the box. If it's not able to be met through the NDIS, where else can we access those supports and services? So someone might be, talking about a support that's definitely not being able to be engaged through the NDIS, but it's still a support that they need. So where else can we get that support? What other supports and services can we link in? It is a very, very difficult situation, but I think this is where your skills come in around that communication and building that trust and rapport with someone to ensure that you can have those really good conversations. And also linking people into carer support services is also really good as well. Okay. Going to Vicky. Our allied health team has implemented a system where we create short questionnaires designed to build evidence. Support workers complete these forms by simply scanning a QR code, which is linked to Microsoft or Google Forms. The collected data can then be exported into Excel and used as logs for evidence. Brilliant. It's been an efficient way to streamline data collection, but I'm curious to hear from others. Have you used QR codes in similar ways? Any insights or challenges you've come across? If anyone can see that post, it would be really good to put some comments in there. I think QR codes and AI and the way we can gather data these days is incredible. The only thing that I would be really thinking about is confidentiality. How do you manage that confidentiality? But any ways that you can streamline the logs and the case noting and bringing all that data and information together to inform reporting I think is brilliant. Okay. Kate, I find it harder to get approved for children and youth with complex needs, especially with families with high complexity, lack of capacity. I know the NDIA say much of the support is parental responsibility, but without supports for the young participant, they don't achieve their goals and cost more in the long term when they have not had early intervention as they don't get it at home. Brilliant point, Kate. It's a really, really difficult thing to do. I think really have a look at that. What is the expectation? If you go and have a look at the operational guidelines around reasonable and necessary, they really delve into the reasonable and necessary criteria, especially that criteria around what is the expectations of informal networks to provide. And I've heard planners say, oh, but it's a child, that's a parental responsibility. What you really need to gather the evidence around is what is the difference between that child with a disability and impairment and how that impacts on them and the supports that they need compared to a child of the same age without a disability. So what's the difference? So what is the increased level of support? What is the increased pressure on the family, on the resources, on their resilience and their capacity to continue to provide that level of support? Really evidencing the difference makes a big impact. And really talking about value for money. What you're talking about here is value for money. So if we put these early intervention supports in place now, what would be the long-term benefit? The long-term benefit is that person will likely have reduced need for that level of support. So providing evidence around that is really important. Okay, hopefully that helps, Kate. Would you recommend using the NDIS templates for reports or doing a separate one? NDIS and PACE, gotta love it. Okay, you don't have a choice. So support coordinators and psychosocial recovery coaches have to use the NDIS templates for implementation reports and progress reports. As part of our training, we also provide you with a support coordinator report template. And it really helps you to clearly provide participants context and articulate it in a way that helps the reader really understand the situation and what's required. You can actually use that template. I always say to support coordinators, if you're doing a change of situation, do not just fill in the template and send it in. That is not enough evidence for the NDIS. You need to be writing a support coordinator report to accompany that template. So what you need to be doing is in the change of situation is that you summarize, highlight the urgency, what are the risks, what are the barriers, what needs to happen. And then in your report, you bring all of the evidence together and you coordinate it all and summarize it and go, this is the context, this is the change, this is the impact, the barriers, the risks, these are the supports that are needed, and these are the supports that we are recommending. So it really brings everything together because we know you get allied health therapist reports that can be 20, 30 pages long. A planner is not going to read the whole report. As a support coordinator, we have a responsibility to bring all that information together, summarize it, highlighting the major points and referring back to those ports where they can get the evidence that they need. Hopefully that helps, Monique. Okay, Kat asks, I'm interested in hearing the experiences of other support coordinators and helping carers to gather effective incident reporting and documentation of behaviour of concern. Who can be more responsible than others on the team for supporting burnout informal carers to do the critical paperwork which ensures the correct funding will provide? CBSP protection is really proactive with gathering risk required. Okay. Support coordinators out there, can you please have a look at this post and then provide some feedback? It's really I find when you've got parents, it's really documenting, especially if you've got support network around that family. If you have incident reports, we'll document challenging behaviours. So gathering incident reports. It's like they were saying at the beginning of the session, asking service providers for risk assessments, for incident reports, for logs around observations of increases in complexity. If the person's living at home, really getting the family to talk about their lived experience and the impact that it's having. their level of resilience, their reduced capacity, if they are falling into depression, or if they are talking about relinquishment, really getting that documented by going to see a GP and getting a report from a GP or a psychologist or a counsellor. Okay, hopefully that helps. Are there any informal advocates you have worked with that actually have resources? In Victoria, we actually only have Legal Aid, Daru, Villamanta, etc. Generally do not have the resources. Really good point, Ariana. Formal advocate are rare because they often work with someone for a long period of time. They often get in there and do the nitty-gritty work, and they work alongside someone. So it's not something that happens really, really quickly. It's something that was highly, highly recommended through the NDIS review around those general foundational supports. So we are hoping that is something. I've already seen increased funding through formal advocacy, so I'm hoping that will be something that will continue to be increased. Okay, new posts. How are we going for time? 46. Wow, lots and lots of questions. I have to scroll back down. Sorry about this, because when I go back to the top, I have to go and find them. Okay. Caroline Hardy, do you recommend a customized template for SC plan review summarizing all the supports requested in detail, like a more detailed report than a progress report on their website? Do you know if the NDIS has a preference? I guess it would depend on the planner. I just want to make it really clear what we're requesting. Okay. Again, the progress reports aren't that you're required to fill them in. I did talk to a support coordinator the other day who really talked about that they do the progress reports, but they also do an end of plan review report. So they pull the data, they use the data from their progress report and do an end of plan review report, which is more in depth. So that could, and they've found that works. But also, again, it's knowing what to put in your progress report. What is the information that you need to put in, and not thinking of it as just a template and reading the questions and then just answering what you think the NDIS needs to know. It's really gaining the skills to understand how can you use those templates effectively. Okay. Joe, for a service that only provides support coordination, does risk management for clients vary from a support worker service? If so, do you have an example? Risk management for support coordination is completely different to support workers. Hopefully I'm getting your question right. Joe, we cover this in the training around professional skills. So risk management for support coordination is really focusing on support worker risk is more around that direct service delivery, yeah? Whereas risk for support coordinators, we're focusing on what are the risks to the participant not being able to access supports and services that they need to be able to pursue their goals and live their best life. So what are the risks? Are there risks in relation to their own behaviour? Is there risks in relation to service withdrawal? Is it around the people that they associate with? So they are the risks that we focus on. And then it's around bringing that stakeholder group together, having those stakeholder meetings or care view meetings. I've heard people use lots and lots of different language to then go, these are the risks. So this is what I'm seeing. What are you seeing? How can we work together and collaborate and share this information and go, what are the strategies that we can put in place to put safeguards in place and reduce the impact or the incidence of that risk actually recurring? Hopefully that helps. Okay. Kelly Meehan, this might be the last one. Okay, when seeking data collection from providers such as sleep charts, as they claim the participant requires active night supports, but they do not provide it, should support coordinators report that they provided to the NDIS Commission, as well as record the provider as a barrier and reports if the participant truly does require active nighttime services? Okay, so two things. If a provider is saying to you, we need to move from inactive to active support, they need to provide evidence, as in logs. Provide the evidence of when you've needed to do this and why, and how is that supported the person. So if they don't have that, then there is the NDIA absolutely won't provide an active support. If you think that it's fraudulent and they're trying to get more money, fraudulent use of the NDIS's, the participants' funds, then definitely you would be supporting the participant to make a complaint. If you find if in another situation there's incident reports, or there's incidences where you find the participant is awake and they're needing support and they're not getting that support, then that is a different situation. So then you would really be talking about, where are you getting that information from? What is the evidence that you're using? What are the risks? And you might even be lodging an incident report if you're hearing this or observing something. Yeah. So be good to talk to you a bit more about that, Kelly. Feel free to email us at info@scacademy.com.au, because I'm not quite sure whether I've answered your question or not, or whether I've actually understood the question. Okay. We're actually going to need to go because we're going to need to wrap up the session. Okay. Last one. Amelia, make sure we've got 5 minutes into that. You mentioned the example of recommending psychology for emotional regulation and skill development. And experience at NDIS has used this as a treatment, and therefore Medicare's responsibility. Just wondering what your thoughts are on this. Okay. Look, it's also, it comes back to part of the reasonable necessary criteria, where the NDIS always go, is the NDIS the most appropriate service to provide the service, basically? So what else is available out there? Can the person go to their GP and get a mental health plan that provides access to psychology appointments? Or is that not an option? Is that not available within their local area? Is it something they need to do via telehealth? It depends on the situation. And it depends on what is the focus for that psychology. So it's interesting that they say it's a treatment, because a treatment would infer that something's going to be fixed. We're working with people with a disability. Their impairment is permanent. It's nothing to get fixed. It's around increasing capacity or skill development or coping mechanisms. So it's really the language you use, understanding why they need that level of support. How does their impairment impact on them? How does that create barriers and risk? Why would that support be needed? So emotional regulation is around their inability to manage their behaviours, and therefore their behaviours exhibit in relation to, lashing out. So really focusing on what is the underlying cause, what will the therapy actually provide and support that person, and what are the outcomes to be achieved. Hopefully that helps. Okay, I really need to stop talking. Okay, thank you so much. Can we get a link to finding these report templates, Kelly? No, you can't. It's part of our training. So it's part of the workshops that we provide when you come along to our workshops. I often get people saying to me, can you just tell me how to fill in this report template? It's not that easy. You need to understand the practice and the systems and processes that you need in place that informs your reporting. The template is the end result. You need to understand the structures and the skills and the processes and the systems, and what you need to gather along the way, the language you need to use, the things that you need to consider, the evidence that you need to gather, and then you just fill in the template. Okay? Hopefully that makes sense, Kelly. Sorry. I will stop talking. I will get the guys to send me any questions that might be remaining, and I'm happy to respond to them as part of this session. And also you can email me at info@scacademy.com.au. Hopefully this has been really, really helpful. Please reach out if you have any other questions. Thank you very much, guys.
Thank you so much, Mary. You really were trying to answer everybody's questions at the end there. Good on you. Honestly, I was looking at all the questions. I was thinking, oh, how are you going to do this? As Mary said, you can contact her with any questions that you have, and she will get back to you. We'll look through all the questions that we've got already on the Q&A chat as well today. And obviously we'll try and answer as much as we can to everybody. So yeah, Mary, another informative and thought-provoking session. I'm sure it sparked plenty of ideas and opened up new ways of thinking about supporting your clients. So now, as we start planning our next webinar topics, we would love to hear your thoughts. If there's a topic that you'd like us to cover or a challenge that you'd like some help navigating, please feel free to drop your ideas in the chat, or alternatively, you can email us on the email that was, we'll pop it in the chat. I think it's hello@endeavour.com.au. If any topics that you have, we want to look into, because these sessions are for you. The most popular topics we've covered throughout our webinar series were suggested by you, so please keep your ideas coming in. And tomorrow you'll get an email with the recording of today's session and a PDF of the presentation. So please keep your eye on your inbox so that you can refresh your memory and see what we've been talking about again today. And finally, we'd love to invite you to join us next month in June. Our next webinar, Supporting a Participant to Manage Their NDIS Funding, is on Tuesday, the 10th of June, at the same time of 12 till 1 AEST. And also, if you missed it earlier, we've just shared the link again to all our previous Support Coordinator webinar recordings. Don't forget to subscribe so you'll know when the new videos are uploaded and ready to be viewed. If you'd like to stay informed and receive valuable updates and resources to help support your clients even better, we've also dropped a link to our fortnightly Care Connect newsletter in the chat. Once you sign up for that, you'll be the first to receive hot topics of information straight to your inbox. Just one last thing before I go. With the webinars, they are becoming really busy. They're getting to capacity pretty quick. I think we had 40 spaces left today out of about 1,000. So if you need to really want to think about getting into registering for the webinars, I'd get in quick. We are going to be looking at other platforms down the line to see if we can have a larger capacity. But just at the moment, my advice to you is they are busy, get in quick. On behalf of Endeavour Foundation, thank you so much for being part of today's webinar. We wish you a fantastic afternoon and look forward to seeing you next month in June. Thanks again. Goodbye.